talk about something which is, if I may use that term, crucial for the success of competency-based curricula. It might be any stream, medicine or any other. But once you are talking of a competent student, then reflection becomes a part of the whole process. Very rightly, reflections was put as an input in the new curriculum that we released in 2019. But somehow, for various reasons, it has not really been used to the extent and the way that it should have been used for improving student learning. And that's why I use the term actually Cinderella. It's important, it's required, but for some reason it is not used. So let's try to look at some of the issues surrounding the use of reflection, why they are needed, how they should be done, and how can we make best use of reflection in our competency-based medical education. And I acknowledge the role of my colleagues, Dr. Nilima Shah and Dr. Ph.D. Gupta, in helping me prepare this presentation. I somewhere read this anonymous saying that to read without reflecting is like eating without digesting. I think it says a lot about reflection. And most of you must have also read this poem by William Henry Davis. What is this life if full of care? And we have no time to stand and stare. Together, these two underline the importance of reflection in our day-to-day life. And when it comes to learning, they become all the more important. What I presume that when Davis wrote this poem, he probably had seen a doctor's life, which prompted him to write like this. And if you look at the medical practice, what we realize is that medical practice is actually messy because there are no set rules. A lot depends on the individual judgment that you make. There are very few situations where you would have a book guideline and you could just straight away treat the patient and diagnose the patient. And with this individualized judgment, you also need practical wisdom, I suppose, more than the theoretical or the practical knowledge. How to use that knowledge probably becomes much more important. And then the peculiarities like problem solving, critical thinking, decision making, communicating, emotions, empathy, and so on. And I'm sure some of you might be thinking in your minds that many of these terms have actually been reflected in the GMER 2019. Whether it is a critical thinker, although it's recently added, or decision maker or problem solver. So the roles of IMG that we have proposed actually involve a lot of these. It is also said that you don't find these things in books, especially if you talk to the senior practitioners, like me, for example, when I talk to youngsters. Very often the comment made is that you don't find these things in book. You have to learn it from experience. Maybe they are right when they say so, but what I would say is that you don't learn from experience. You learn from reflecting on an experience. And that is where the role and utility of reflection actually sets in. If we look at the linkages that reflection has with learning, what do you find? Is that actually reflection is very intimately related to student learning. We will talk about it in detail. It's related to assessment. Many of the competencies which we have actually listed for IMG are not accessible by conventional means. And this is especially true of the behavioral competencies. Their reflections can provide a very valuable evidence of learning. And more importantly, even for the professional development of the faculty, reflections play a very important and a very useful role. Now, what is reflection? There are various definitions possible. In fact, if you Google what is reflection, you will come across more than 50,000 versions of what people think reflections are. I have picked up some of the important ones, especially from the medical literature, mainly medical teacher, where the reflections are actually related to the competency-based curricula. So what Sanders says is that reflection is a metacognitive process. Please note the words. Reflection is a metacognitive process that occurs before, during, and after situations. So reflection is a continuous process which happens before, during, or after the experience to develop a greater understanding of both the self and the situation, so that future encounters with the situation are informed from previous encounters. So if we analyze this definition, what it means is that reflection is a continuous process. It helps to better understanding of not only self, but also of the situation. And it's a process which helps you decide the future course of action based on your past experiences. If we use a common phrase that is said that if you don't learn from your mistakes, you are bound to repeat those mistakes. So reflection actually is a way to learn. I won't say your mistakes. I will say to learn from your past so that your future actions and your present actions can be better. They can be more appropriate. Boyd and Fields, 83, they defined reflection as a process of creating and clarifying the meaning of experience, past or present, in terms of self, self about self, and self about the world. You might notice it's only a change of words, but basically the purpose remains the same, and that is to gain a meaning out of the experience, which either you had or you are having. And you learn not only about the experience, but you also learn about yourself. Yet another Dewey, in very old definition, 33, says that reflection is active, persistent, and careful consideration of any belief or supposed form of knowledge in the light of ground that support. So you just don't follow what others are telling you. You are trying to look for evidences which support those practices. In medical practice, you come across so many things. There are folklores, there are community treatments, there are treatments coming out of experience. You don't blindly follow those. What you do, you look at the knowledge and the ground which supports that knowledge. So if we combine all the three definitions, what becomes clear is that reflection is a means of making meaning out of your experience, past as well as present, and it is a mechanism to have a better understanding of self, of course, the experience, and to use this understanding for your present and future actions. So thinking about something, pondering on experience, asking yourself questions, these are some of the things which you would be doing subconsciously. You see a patient who didn't behave the way he or she should have been, and then you keep on pondering, why did it so happen? His blood pressure should have gone up, but it actually came down. Or you gave hematinics to this patient, but in spite of a long treatment and very good medications that you have prescribed, the hemoglobin is not coming up. So you wonder what has happened. So these are some of the questions which actually keep on going in your mind. And these are exactly the questions which help you to make meaning out of what you are seeing in the present experience. So, from this perspective, reflection is taking responsibility for your own learning in different situations. The teacher might give you a lecture, the teacher might show you a patient, he might show you an experiment. But to make meaning out of that lecture or that experiment or that patient, you need to reflect. And in addition to knowledge and skills, you also need to reflect to learn about your own values and those of the patients. There are many such examples. A student may encounter a drug addict in the clinics. Now, what do? Start hating that man because he's taking drugs? Or try to look for reasons and help him out? In a pediatric OPD, you encounter a mother who is not breastfeeding her baby. Now, what do? Get angry on the mother? Or try to look for reasons and try to help the mother so that the baby can get the best nutrition? No, these are the situation, your values, your emotion. And mind you, if you get angry on the mother, you are actually blocking the communication. Whatever other advice you give to her would not be followed. And so it is important to be clear about your emotions. Not only your emotions, but also the emotions of the patient. You tell them something and they get angry. Why? So these are the things which reflection can actually help you with. And look at the key concepts related to the IMG training, lifelong learning, self-directed learning, being a professional, being a leader, being a communicator, doing ethical practice are some of the examples which actually can come out of reflection. And most importantly, although I put it in the end deliberately to emphasize, and that is becoming a good clinician requires a lot of reflection. If it was not so, then probably reading the books would have been enough, more than enough to become a good doctor. But it doesn't happen. A lot depends on how you analyze the experience that you have seen in the clinics, in the ward, in the classroom, and then formed an opinion about how to treat the patient. Now, while I said that reflection is a deep personal evaluation of an experience, it's an account of the thoughts and emotions associated with that experience. Generally, reflections are written in first person in active voice. I saw this patient and I thought. I saw this procedure and I was surprised at whatever. It is a manifestation of the state of the mind of the writer in all honesty. And it's an evidence of learning and future course of action. More importantly, what I want to emphasize here is that reflection is not merely a summary of the experience describing factual details. And this is, in fact, one of the most common mistakes that people make while writing reflections. I'm sure most of you are dealing with the students who have to write reflection. But when I even saw the reflections of the faculty, they used to write during ACME training or FEMA training, then most of the time it is just a recall. we came at 9 and then so and so took a lecture and he took a class and he showed some examples and that's it. So reflections are not simply a recall of the chain of events. Reflection is the meaning that you draw out of that. They are not obvious learning points from that experience. Something so clear. I learned about the composition of ORS. That's probably not reflection. It's not a general interpretation or feedback. It was very good class and it helped us to learn. That doesn't really make sense. It's not a fictional or literary piece of art to describe the experience. And it's not simply a record or documentation of a task performed or experience attained. I'm sure this reminds you of your logbook. So simply writing something in the logbook doesn't actually become a reflection. Logbook only records or documents what they have been taught, what they have done, what they have seen. But when they start writing what they have learned, then it becomes reflection. And incidentally, that is the difference between a logbook and a portfolio. A logbook would have only the documentation of experience. Portfolios would include evidence of learning. It could be in the form of marks that they got. It could be in the form of reflections that they have written. It could be in the form of some project that they have produced. It could be in the form of some model that they have made. Last week, when we saw the students making charts and models about anatomy and physiology and biochemistry. So that is an evidence of learning. They were told something and they were able to put that into practice and create a mini experience. So that is what reflection is all about. So please keep this in mind. Whenever you tell your students to write reflection, don't just be happy with a factual recall of what has happened. One has to move beyond that. Now, in competency-based medical education, as I said right in the beginning, that actually reflection is a part of competence. And I take you back to the iconic definition of competence given by Epstein and Unit. We all have learned this definition when learning about CBME. And what this definition says is, is a habitual and judicious use of communication, etc., and reflection. So in other words, a competent Indian medical graduate is also competent in writing reflections. Now, it depends. You can call reflection a tool, or you can call reflection itself as a competency. But more important than deciding about which word and which noun to use for this, what is more important is that reflection is a part of becoming clinically competent. And keep that in mind. So in CBME, what will reflections do? They will help the students to learn, obviously. Second, they help the students to develop a better clinical or therapeutic relationships with the patients, because largely the emotions, they come into picture. And thirdly, and very importantly, they help in professional identity formation. When a student enters your medical school, he has not formed an identity as a doctor. Throughout the 5 years or 5.5 years that he is with you, they are trying to develop their identity. And reflections can help the students to develop their identity. There are many examples. I'll give you some things to read, which will show you how writing reflections at various levels can actually develop identity as a clinician, as a professional, as a communicator, as a leader, and so on. And if you look at these roles of IMG, almost every role requires reflections. In fact, there are many roles for which you may not have a objective evidence of learning in the form of assessment. What assessment will you have for leadership? What will you have for communicator or professionalism or lifelong learner? Nothing. Even critical thinker. The only evidence that you can have can actually come from reflections. And please don't take it like this that clinicians don't need to reflect. In fact, that is one important area which needs reflections more than any other role. Now, what is more useful, reflections or practice? In fact, I refer to this seminal work of Di Stefano, 2023, very recent. So what they did is they gave a group of people repeated practice of the task. And to another group of people, they gave practice, and after a certain stage, they only asked them to reflect. Interestingly, reflecting on the experience actually provided better results compared to more practice. And this is very true for the clinician role. I remember when I was doing my post graduation, and I think I shared this story with you earlier. I was very poor at inserting IV can in children because that time we didn't have these butterflies and all those things. We had to use a 23 gauge needle and insert it into the femoral vein to give IV fluids. And I was very poor at that. And then my colleagues, nursing staff, teachers, they all taught me. Of course, practice was there. But then I used to reflect a lot. When I was successful, what were the factors? Where did I put the needle? Which were the structures which I palpated, the artery or others, so that I could enter inside the vein? And that is where it helped me a lot. I'm sure you all can actually think of similar examples from your own lives. Another interesting study published in 2009. If there is no feedback and no reflection, there is hardly any improvement in performance. You give only feedback to one group and no reflection. There may be some improvement. You give feedback and reflection, highest improvement. And no feedback, but only reflection, again, no change. So what it tells you is that giving a feedback is important, as important, but without reflection, that feedback actually doesn't work. So when you give feedback to the students, make it a point to ask them to reflect, because that is what actually will result in a better performance compared to giving feedback alone. Another data, 2013 publication. I said you reflect on all experiences, whether it is a successful experience or it is a failed experience. If it's a failed experience, you reflect on why did I fail? If it's successful, you reflect on, wow, how was I successful so that I can do it next time? And in a failed experience, reflecting on both erroneous actions as well as correct and erroneous actions actually gave the most improvement in performance. Whereas in a successful experience, your focus on erroneous actions actually results in a better performance. So the focus varies, the utility varies. How do you promote a reflective culture in your teaching? And Making a reflection oriented discussion is one of the best ways. So rather than asking the students at the end of the class or case presentation or practical, what did we do today? Simply ask them, what did we learn today? And that makes a lot of difference. What did we do is very easy to say because they have to simply recall the events. But what did we learn requires reflection practices. And then writing reflections on some personal and specific experiences is another way to actually promote reflective culture. Now, what you should be reflecting on. These authors, Koshi and others in 2017, actually gave a long list. But I have one very simple answer to this question: everything. So, what you should be reflecting on? Everything. How much effort and energy you put will, of course, vary with the task and importance and so on. But if you want to specify them, then anything which disturbs the status quo. I had always thought if you do this, the patient should improve, but he has not improved. An opportunity to reflect. Something which creates turmoil. I was trying to help the patient was so rude to me. I'll give you one small example what I had during my PG training. We had a very sick child in the ward, and one day on the morning rounds, he had shown considerable improvement. So while I was taking round, the mother asked me, "What should Doctor साहब इसको क्या खिलाऊं?" I said, "जो मांगता है दे दो." And there the mother started crying. I never understood. I said, "अच्छा हो रहा है जो मांगता है दे दो." She cried more. It's only later on that she came out that this is the phrase that is used when somebody is about to die. You know, some old man in the house, and when they say "jo mangta hai de do," it implies that he is not going to make it. So, turmoil, something which raises questions, something which arouses emotions, and something that went wrong and something that went well. So, in other words, everything. That is what you should be reflecting on. So these are some of the sources of reflection which I have already enumerated. So everyday events, positive, negative experiences, eventful incidents, unusual incidents, important incidents, meaningful events. So you need to actually look for the opportunities to reflect. So why reflection becomes important? Because reflection helps you to bridge the theory and the practice gap. What your teacher told you about good communication, and when you actually talk to the mother, you learned it in a very different way. That is what helped by reflections. It reduces practices based on custom. Rather, it encourages practices based on experience. It understands the decisions which are made, lessons that are learned, and more importantly, it ensures that the patient care remains patient centered and based on the patient experience, not on what you have heard or what you have been told in the community, for example. If you give vaccines, they will cause more problems. So people don't take vaccines. Now, what kind of skills you need to develop in the students to make them become reflective practitioners? First and most important, they should be willing to learn from experience and change as a result of that reflection. They should be able to take out time for reflection. In fact, one of the most common reasons for not giving reflections their due is lack of time. Already इतना काम होता है. So learning a skill and writing a logbook and seeing so many patients is more important than writing reflections. Then being open and honest. This can be very tricky. Suppose a student is with a particular consultant, and after some days he finds this consultant is actually forcing patients to buy medicines from one particular shop or get investigations from one particular lab. And suppose he writes all this in his reflections, then it could become a problem. So what students would generally tend to do is to write what is socially acceptable rather than what is true or honest. So you have to develop a way and means and a mechanism so that they can write what they have seen. They can learn from that experience without making too much noise about it. Then they should be willing to share and discuss the experience. They should analyze their experience. And based on all these, they should be able to make an action plan for future action. Now, what does reflection involve? It involves certain slowing down. Remember Davies' poem, "What is this life full of care? We have no time to stand and stare." You have to take some time to hit the pause button and look back at what you have done or seen. And during this pause, you have to examine, analyze, and inquire about the various complexities of medicine and medical practice. Then, active choice to pause and examine, and it should not be a passive process. Not that a teacher forces you, okay, I again remembered I had once gone to Chandigarh, and from my uncle's house, we could see his school, nursery school kind of thing. And then there used to be a bell at 10, and everybody was, "So jao." And every child would, you know, try to go to sleep. You cannot have reflections like this. You can't just force them. Okay, reflection likho. It has to come from within. It has to be an active process. You just can't passively force it on them. Then multiple cognitive processes are involved: analysis, synthesis, evaluation. And if it reminds you of Bloom's taxonomy, then you would notice that they are actually the topmost level of Bloom's taxonomy. And it can take many different forms and functions. I'll give you one example from one of the most common models which is used for writing reflection, and that is the Gibbs reflective cycle. Published in 1988, Gibbs gives some very useful ideas about how to write reflection. Let me quickly touch on what it involves. First, you have to select an experience. I was shown a patient who is an alcoholic and was brought after having a quarrel in his house. Now, what is the experience? What are your thoughts, your feelings? What was positive? What was negative? What did you learn? So, pick up an experience. Second, describe it. And that becomes important. You're not describing from a third person point of view. You're describing it as you perceived it. Where was I? Who else was there? Why was I there? What was I doing? What happened? Second is feelings. And that is actually what differentiates a logbook from reflections. Feelings. What kind of emotions it generated in you? How were you feeling at the beginning? What were you thinking? What were other people doing and how did they change your thinking and emotions? And what do I think of it now? Do I still have that negative feeling about the mother who is not breastfeeding the baby? Or after listening to her story and her problems, have I modified my opinion of the whole thing? That is the feelings part. Third, evaluation. What was good in it, which I can follow? And what was bad? I didn't communicate well. I didn't use a language which was understandable by the mother. I became angry when the mother was not listening to my advice. What was bad? Because that is what you have to avoid next time. And what was good? Because that is what you have to repeat next time. And analysis. Based on what was good and what was bad, try to analyze. And these are some of the points actually, which will help you to write or analyze the experience that you just had. And then comes the conclusion. Would I have done something differently? If I had not told them about this thing, would things have been different? What are the key things that I have learned? And importantly for us, can this be the evidence of attainment or placement of competencies? When your behavioral competency says a student learns how to communicate with the patient or function effectively as a leader of the health team, then can this experience be taken as an evidence of the leadership skills or the communication skills that the student has demonstrated? And action plan. So in future, if same situation is to arise again, what differently or what things similar I'm going to do again? How will I do it? Do I need to make some more changes in my knowledge, skills, and behavior? And what competencies should I now focus on? In the communication competencies, I learned one, two, three, four, five, but I think six, seven, eight are still some things which I have not adequately learned. So that is what I should be focusing. And please remember that this is not a one-time process. This is actually an iterative cycle. So from analysis, you will go back to again another experience and probably try to repeat the same cycle. These are some other models which you can use. I don't intend to go into details of all these models. If you're interested, you can Google them, you can learn about them. Why I am listing them here is that not every model is useful for everybody. Some people find one model easier, others find another model easier. So you can experiment with different models. You can actually think of what model you should be using and how you should be using it. Now, basic things to be successful include that you have to experiment with different approaches. So you use different models, use different times, and so many other things. Second, commit to give time to reflections. That is probably one of the key factors which will decide whether students reflect or they don't write. Now, often we say that if we ask the students to write a reflection, and there are say 150 or 200 students in the class, and even if they were to write two or three reflections, then I'll end up having 300, 400 reflections with me. Who's going to assess it? That's one problem, real problem, because teachers are also hard pressed for time. So where do they get time to assess all those reflections? May not be possible. So your teaching can actually include lot of activities which will promote verbal reflections. Take some examples. In the classroom, you could ask reflective questions. You could use 1 minute papers. You could use think, pair, share, quiet time, or various prompts like movie clips, literary pieces, poetry, flashcards. Reflective questions. I'll show you some examples after this. And then what we call aha moments. Oh, I never thought like this. Or I used to believe, but now I think. So every student says one. I used to believe this about drug abuse, but now I think in a different way. And I hope this reminds you of something. These are the techniques which you use for interactive teaching. And these are the techniques you use for formative assessment or assessment for learning. So using these techniques actually helps in more than one ways. Not only it makes the teaching more interactive, it provides feedback to the students, and it supports reflective processes. In the clinics, you can use many of these things. And one of the co-authors of this paper, Nilima, she actually had this practical experience. At the end of her class, she'll say, "What did we do today?" So they'll say, "Oh, we saw a patient of depression and with this and that." What did we learn? No answer, because they never thought that way. So now she has made it a point. She doesn't ask, "What did we do?" She simply asks, "What did we learn?" And that actually prompts the students to think in a different way. During formative feedback, I showed you the slide with feedback and reflection. The performance improvement following reflection on a feedback. So, and if we are using Pendleton's model, that is what we do. For you first ask the student, you rate your performance, and then you give feedback. So that's a way of promoting reflections. And as you would see, these aha moments I used to believe actually comes everywhere. And these are the moments which happen in every class. Just ask them to identify, ask them to pick it up. Of course, writing reflections on 3 to 5 individual learning experience can be there. And if you ask them to write and submit, plagiarism will be a problem. How do you check they have not copied from their friends? And sometimes it might actually move out of the institution. They are copying from somebody in college A and college B is copying from somebody in college C. So an electronic submission with a very simple plagiarism detector is something which probably needed to be in place to avoid the instances of copy pasting. I told you about sample questions. These are from community medicine posting. So if you ask some of these questions, they are not questions related to knowledge or skills or attitudes. They are questions related to their feeling of the experience. And so asking these questions is actually going to motivate them to reflect on their experience. So how do you motivate yourself to go to rural areas when you don't like it? Now, that could be solving a lot of problems for you as well as for the students. Now, in the previous one, I have talked about oral reflections and written reflections. Which one is better, oral or written? Oral has the advantage that you could do it quickly on the go. You have shown them a patient, simply ask them, okay, what did you learn on this patient? Done. If you ask them to sit and write, then probably they need time and that mindset and paper and pencil where they would write. But at the same time, written reflections, they consolidate the thought process. They are considered more beneficial. They provide records. That is important. If you want to review for later situations, then written reflections will provide record. They give way to emotional catharsis, something which may not be possible verbally. In front of the consultant, for example, the student may not really bring the heart out, but during reflection, it can. And studies have shown that benefits of written reflections are better than simply reflecting verbally or orally. Now, assessing reflections is a problem. And whatever experience I have had since 2019, I can say that the major reason for teachers not asking the students to reflect is this extra work. Who's going to assess those 300 reflections? Where is the time? How will I do it? Perceived difficulty, plagiarism, and many of them see it as a non-academic activity. वो पढ़ाया तो कुछ नहीं ऐसे ही लिखने को बोल दिया. And there can be a lot of emotional issues involved. There could be a lot of things which they may not like to bring forward because of the various reasons that I mentioned before. And please also remember that in your theory and practical, you have a predefined correct answer. For reflections, there are no predefined answers. They are unique. Every student will write differently because every student will learn differently from the same experience. Now, that makes it actually more difficult to assess. And most important, as I have been repeatedly emphasizing, is the volume of reflections generated. Now, when you are assessing, Look at these four things: how much depth, how much exploration of the feelings, how much challenging of assumption has been done, and what kind of new insights the student has developed. In fact, some people say, why you need to assess reflection? There's something called Goodhart's law. I mentioned it in my talk on subjective assessment. So what happens is students very quickly pick up what the teachers want to read, and they will write what you want to read rather than their own feelings and their own emotions. Plagiarism can be a problem. There could be discomfort in sharing their thoughts with others. But also remember that what is not assessed is not learned. So asking them to write but not assessing them will probably not convey the importance. So you have to maintain a balance. And then McNamara fallacy, you could simply, end up saying them write five. They'll write five. But what is written in those five is generally ignored. So what we suggest is that all reflections need not be assessed. Because the purpose of assessing reflections is not summative. You're not going to decide pass fail. So at the most 3 to 5, or even I would cut down to 2 to 3, 2 to 3 reflections per subject per year. That should not be much. Even if you have 200 students in your class, so 400 pieces throughout the year is not something which is very difficult for a department which has, say, about 8 or 10 faculty members. And use these reflections to initiate discussion rather than assigning grades. Because once you start assigning grades, they will start either copying or writing socially acceptable points, not what they have actually felt or what they have actually learned. There are various models. I don't intend to go into those models. You can look for them, Google them, find out what they are. When more than 50 models are available. So if you really want to assess them for internal assessment, then use one single model. Don't go into multiple models because that will tend to confuse the students. So the bottom line about assessment is the purpose is to help learning and develop the competence to be a reflective practitioner rather than to be somebody who can write a literary piece. So discussion in a group or with peers for knowledge and skill competencies can actually become a useful point. Another thing which you can actually try is to help them write guided reflections. You could share with them your own emotions. When this patient said this, I also didn't feel good. But I know that because the patient is sick and so many things were there, so I anticipate that he might be angry. Those kind of guided reflections you can help. And you should be addressing the ethical and emotional concerns. I gave you some examples. So you have to maintain confidentiality and sometimes, adverse effect of drugs or some patient dying and a student perceiving that the clinician didn't do this, so a patient died wrongly or rightly, whatever. But then these kind of issues could actually crop up. So 5 C's is one of the methods of promoting reflective culture. One, that they should be continuous. Weave into the curriculum. Don't make it a separate event. In fact, that is one of the commonest mistake we can make. We made SDL a separate issue, which is not. Don't make reflection as a separate event. Now is the time to write reflection. No, it should become a part and process of the curriculum. So it should be continuous. Second, it should be challenging to the students so that they can look at the existing knowledge, existing beliefs. You coach them, guided reflections. While they are reflecting, you connect the classroom learning with real and match with the level of the student. So continuous, challenging, coaching, connecting, and contextual. So these are the 5 C's which will help you to promote reflective culture in your classroom. Here are some examples. You see a description of an event. You see what was different. I used to believe, but now I believe like this. And you see evidence of learning, that it is not appropriate to pass off all rashes as drug rash, and more careful follow-up is needed. So another example, you get an evidence of learning. In your checklist-based assessment on communication skills, probably these kind of things would have never come up. And much of what I said is going to be published in August issue. So you could actually read more of it. And I'll be happy to answer any questions that you have on reflections. Yes, I would encourage even people who are online, in case they have a question or a query or a comment, please feel free to say. So what I would actually suggest is you reflect on what we just had. Is it applicable? How can I use it? What more skills and competencies I require to make my students reflective? So these are some of the points which probably you need to be asking yourself.
Sir, Dr. Garewal, I hope I'm audible. Can you hear me, please?
Yes, yes, we can hear you.
Sir, firstly, compliments, appreciation, and respectful regards for another highly educative and value-added information that we received from you. I think, you are truly inspirational, number one. The question that I have is that reflection sometimes results in a negativity of could I have done it better? Did I not be, was I not appropriate or professional or competent enough in my interaction with the patient or with a class in a classroom setting? Uh, how does one take out the negativity that one carries as baggage and burden and use it as a positive input to, let's say, improve?
That is where guided reflections actually become important. See, negative learning or negative events would always be a part of your learning process. I don't think anybody can say that I never made a mistake in 5.5 years of my student days or during my PG training. Every one of us has made mistakes. But have we learned from those mistakes is actually important. And how do you avoid those mistakes in future becomes even more important. If I may give you an example, I had a patient in the casualty on a Saturday evening. At CMC, Saturdays are generally evenings are off. So I was at home. I came there to see the patient. I saw, and after seeing within 5 minutes, I told them, looks like leukemia. Everyone was ready to pounce on me. डॉक्टर साहब आपने तो आते ही हमको ये कह दिया आपने तो हमको सोचने का मौका ही नहीं दिया आई थॉट दे वुड टेल मी कि वाह कितना अच्छा आपने देख के डायग्नोज कर दिया but they were all after my life you didn't give us time to settle, you just came and announced he is leukemia. So that was something which made me realize that next time when I have a patient like this or a situation like this, I should not be you know using it like a bombshell. I should not drop a bomb. So first prepare them to be ready to accept that bad news, and then you come out with this. So same way, if a student has a negative experience, he must document it. But as a faculty, we need to tell him that this is a learning opportunity, and in future or next time if he encounters a similar situation, then he should not be using or he should not be repeating the mistake that he made now.
Thank you very much, sir. That is, helps us maintain our equilibrium to, turn negativity into learning experiences, which will definitely improve our teaching learning interface. And thank you once again, sir.
Thank you for your comments.
Sir, I have a query.
Yeah.
So by default, till now, my understanding on reflection was always that it is to reflect during or after the process. But the definition by Sanders has opened another domain where it says you also reflect before the process or the experience. And we have been using models mostly what happened, so what and what next. So I feel that probably adding what were you anticipating or expecting would add on a good domain to the reflections.
So, Ruzi, you actually gave a very nice example of I used to believe, but now I think, you
And
know.
reflecting and
Yeah. So you used to think that reflection can be only in on present or future, but now you know that reflection can be in anticipation also, and that is very right. See, whenever you have to perform a difficult procedure or you have to give a talk in front of a very large audience, don't we keep on thinking in our minds that when I go on stage, I will do like this, I'll speak like this, I will use this example, I will show these slides. Are we not doing that? When I came here, before I started talking, for 1 hour, I was actually thinking what kind of examples I can give to emphasize my points.
right,
So, anticipatory reflection is as important as reflecting on the past. And if I use other terms, in one of the sessions, we had said feed up, feed forward, and feedback. So when you say feed forward, you are actually looking at anticipatory. When you say feed up, it is the present. And when you say feedback, is the past. So these are all accepted principles. But thank you for picking it up.
right.
Okay, so if there are no more questions, then we'll end the session. Thank you so much for being with me and listening to my presentation. So
Thank you,
have
sir.
a nice day. Have a very, yeah,
Thank
you
you,
have some
sir.
questions, Dr. Lakshmi?
Sir, no, sir. No, sir. Thank you so much.
Okay.